Welcome back to my channel. In this video, I'll be explaining the triangles of neck in a very easy way to remember so that it is easy to recall during the exam. So just remember one simple diagram and it will basically suffix all the things. So suppose this is our neck, right? And then this is the clavicle. Now, just remember that there is this line and this is the sternocleidomastoid muscle, and I have a triangle. I have a triangle which extends like this, and then I have a triangle which is still back, and then I have something like this. Now just this diagram is important. Now just label it. This is the digastric, carotid, muscular. All right, let's just get started. So first of all, the first basically we'll talk about the anterior triangles. Now in anterior triangles I have four triangles: the submental, then I have digastric, then I have carotid, and we have the muscular triangle. Now in submental triangle, I basically in this diagram submental is not there, so I will just draw one simple diagram and I will hope that it will be self-explanatory. So so suppose there is something like this, and yeah, basically I just made it a little haphazard, but it is easy. Yeah, so let's just understand the submental triangle. In submental triangle, basically what you need to know is this is the triangle that I am talking about, this one, this whole triangle. So in submental triangle, first of all, this is anterior belly of digastric. Now in submental triangle, what you will see is that the boundaries are formed by the anterior submental triangle. Okay? Anterior belly of digastric. Then one thing you need to remember is base is by hyoid bone, which you can see in the diagram only. This is hyoid bone. Then you need to remember floor of each triangle. So floor is by mylohyoid. This you need to remember. Then in contents, I already made it. That is the submental lymph nodes. All right, now digastric triangle. Now let's go back to our diagram of this one. Now here what I need you to know is that this is the posterior belly of digastric, this is the anterior belly of digastric, this is the base of mandible, right? And yeah, so and in digastric triangle antero inferiorly. Now just see the diagram and think about it. Antero matlab in front and anteriorly, this diagram, basically we are talking about this one. So this is like anterior belly of digastric. Okay, so antero inferiorly I have anterior belly of digastric. Now posterior inferiorly, I told you that we have posterior belly of digastric. Just see the diagram and just memorize it that way. And this is our posterior belly of digastric, right? Then base is by base of triangle is by base of mandible. I told you this is the base of mandible, right? Then floor. Now remember, floor is a very important question in all the triangles. Now floor is by two muscles. One is the mylohyoid, which was also floor of submental, and hyoglossus. Hyoglossus is important. We will do the relations of hyoglossus in some other video. Now let's talk about the carotid. Now carotid may you can see that the antero superior is by posterior belly. All right, now you will be easily be making out here the concept. So in this one, see this, right? So antero superiorly open and in front. Antero superiorly you have posterior belly of digastric, and antero inferiorly this is superior belly of omohyoid. Superior belly of omohyoid. ठीक है. Posteriorly you can see that you have anterior border of sternocleidomastoid. So posterior you have anterior border of sternocleidomastoid. Now floor is very important. Floor by middle constrictor, inferior constrictor, and thyrohyoid membrane. ठीक है. Then yeah, then you can also talk about the contents of carotid triangle. Sometimes there is a question, so you should know. Contents may you can think of it as three parts. We will talk about in three parts. One is the artery. In artery, just remember all the carotid arteries: internal carotid, common carotid, external carotid. In the vein, remember it as sepal. So sepal is like common facial vein, I internal jugular vein, P pharyngeal vein, and L is lingual vein. Alright, then in nerves is important. Nerves may just remember you have 10th nerve, 11th nerve, 12th nerve, and superior laryngeal. Alright, nerve. So these are the contents of carotid triangle. Now let's talk about the muscular triangle, which is usually difficult, confusing, but it is very easy if you remember this diagram. Now in muscular triangle, what I want you to think is, know is that this is the line to the, basically we draw a line from the sternothyroid, line from sternothyroid. So let's just get into it. Anteriorly, it is a line from sternothyroid. Then postero inferiorly, superiorly. Postero superiorly. So in this postero superiorly, like पीछे से and in upward. So it is the anterior superior belly of omohyoid. Like, can you see this, right? So superior belly of omohyoid, and postero inferiorly you have lower part of anterior border of sternocleidomastoid. So this completes the boundaries of muscular triangle and basically all the anterior triangles. I hope I made it easier for you to understand and remember. In case you like the video, do subscribe to my channel and basically just remember this diagram and it will solve most of your problems. So yeah, so thanks for watching.